Should you have your dog spayed or neutered? So you're probably watching this video if either you've just got a dog for the first time and you're not sure what the right thing to do is. You might have a behavioural problem with your dog and you're thinking that this could be a quick fix to resolve that problem. What is the science saying, and is neutering a dog a magic bullet, or is that just a myth? So I think there's an old school way of thinking, which is if a dog shows some behaviours, maybe aggressive behaviours, reactivity, whatever you want to call it, quick way to solve that is to get them snipped. And I'm thinking more of male dogs in this, but it could be females as well, of course. A quick biology recap: the ovaries and testes are responsible for producing testosterone, estrogen, progesterone. These are not only reproductive hormones, but they're also responsible for stress regulation. They're responsible for social and behavioural development and brain development. Removal of these will drastically decrease the amount of those hormones that are in your dog's system. So before we get into what the science says, just a quick note on fulfillment, and I'm going to do a separate video on this. I think a lot of the time when we're considering this, we are treating the symptom and not the cause. We have a dog who is reactive, and we think that due to that symptom, we have them neutered, and then that gets rid of the problem. Something to call out up front is a lot of the time that will be down to a lack of training and behaviour management, also fulfillment and giving your dog suitable outlets for behaviours. As I say, I'll do a separate video on that, but I just wanted to call that out. Just be careful you're not just treating a symptom, you're making a permanent change to your dog's anatomy, and I think that you need to be careful before doing that because it will affect them and it will change their personality. To go alongside that, I'm a behaviourist, so I'm a dog behaviourist. I'm not a vet, and I'm not trying to sound cleverer than I actually am, which is an important note. From a physiological perspective, these hormones are responsible for muscle mass, bone density, and have shown more problems in joints and hip dysplasia and things like that in dogs who have been neutered. So again, not a vet, but there is a lot of science to back that up. I will link some papers in the description of this video, but those will be related to behaviour because I want to stay in my lane and not pretend I'm a vet. So one of the largest studies on this showed that neutering did not reliably reduce aggressive or fearful behaviours, and it actually showed increases in those, particularly in male dogs if they were neutered too soon, so like pre-12 months. And that's an important note because there's something called percentage lifetime gonadal hormone, which is essentially the amount of time that your dog remains intact and has the full complement of hormones going through its system. The science basically says that the longer the better, essentially. So if you do decide to get a dog spayed or neutered because you're concerned about population risk and uncontrolled breeding, and you still want to do that because you want that security, I think it's fairly standard for vets to say allow your female dog to have at least one season, but there's also research to say that male dogs should be left intact for longer than a year as a minimum. So what does it reliably decrease? So it will decrease marking behaviours, it will decrease mounting and humping type behaviours, and it will decrease roaming behaviours. Dogs who remain intact being more difficult to get on a reliable recall, for example, because they're probably roaming to go and mate, reproduce, have puppies, and that's obviously an inbuilt genetic thing that all animals have. So you remove the hormone behind that, the drive, then a lot of that reproductive desire will obviously go with it, or all of it. What it doesn't reliably reduce is aggression and fearfulness, and can increase those problems. As I said originally, I think a lot of people think of spaying or neutering as a magic bullet to fix behavioural problems, and the reality is it just isn't. So what can you do? Well, socialisation, training and behaviour modification, and genetics are far better predictors for behaviour and outcomes of behaviours. The good news is that you don't need to alter your dog to do that, and the dog doesn't need to go through a surgery. But the bad news is you're probably going to need to put some work in, and you're going to need to speak to your vet and a behaviourist to establish exact context and problems around those contexts and work out a way forward. So what should you do if you've watched this and you're still thinking, do you know, maybe we will still just do it? Firstly, don't expect a quick fix. Secondly, exhaust behaviour modification before you even consider modifying your dog permanently. Thirdly, make sure you've discussed in detail with a vet and a behaviourist the problems that you're having, so you can establish whether there is a likelihood that spaying or neutering could help that. So anecdotally, and that goes against kind of the whole point of this video because it is meant to be based on scientific research rather than anecdote. The dogs that I've trained and dogs that I've owned that I've actually had neutered because that was the vet advice at the time, the behavioural changes I've noticed tends to be more nervousness and less confidence in certain scenarios. So just be cautious that you are going to change the dog, and sometimes it isn't always for the better. Just be cautious before you make a big decision like that. There are implants and other things available if you want to kind of investigate those with your vet. Read the articles that I've put in the description and make an informed decision.